All right, we're trying something different today. I've been recording a variety of question and answer videos for the Legion Strength and Conditioning Instagram account, which is at legion.sc. And due to the oppressive nature of social media, I'm restricted to speaking for 1 minute at a time, which is usually insufficient to actually get my thoughts out on a specific topic. And John Colborn, who's been filming me, has developed a series of hand signals and gestures to kind of alert me to how much time I actually have left when I'm speaking. He'll let me know when I have 30 seconds left. He'll let me know when I have 15 seconds left. And I've gotten pretty good at actually kind of, summarizing my thoughts suddenly when I'm about out of time and trying to come up with some sort of clever closing statement, even though I have 15 more minutes of ideas I'd like to talk about. So I've decided to record kind of a medium-length podcast discussing one of these ideas, which has to do with the application of rehab principles to performance-based training, which is a really interesting topic to me. I've done a lot of continuing education on rehab-type principles and been working on applying them to my own practice of training performance-based athletes. And I think there's a lot there, but I also think there's a lot of misinformation and misunderstanding about how these principles actually do apply to people who care not just about improving themselves from being in a painful situation, but to actually getting better at a sport. So if you think this type of episode where I sort of ramble on a topic that I think is interesting is helpful or insightful, and it's a good use of bandwidth and brainwaves and all that type of stuff, let me know and I can keep doing these things. And if you don't like it, I will probably keep doing it anyway. So unsubscribe and have a bad day. All right, so today we're going to talk about the application of rehab principles in performance-based training. As someone who's taken a lot of continuing education courses, particularly in the strength and conditioning area and in the rehab setting, I see a lot of confusion in terms of how to actually apply a bunch of these different principles. And if you go online, you'll see a bunch of coaches who have taken courses like PRI from the Postural Restoration Institute. You'll see coaches who have taken things like DNS, Dynamic Neuromuscular Stabilization. I think this stuff is awesome. Me personally, I've found a ton of value in actually going into these courses where, I'm not very knowledgeable in terms of having a formal physical therapy education background. So going into something where, the information is essentially a cousin to the information in strength and conditioning, I found it to be a real forcing function to force me to learn more and to be outside of my comfort zone and to understand how people from a different background will view movement, how they'll go through their assessment processes, all those kinds of things. So there's tons of value in actually pushing yourself outside of your comfort zone, but I think things get a little fuzzy when we're talking about actual application of how these principles should be utilized in a performance-based setting, right? So we're talking about strength and conditioning coaches, we're talking about CrossFit coaches, we're talking about personal trainers, all that kind of stuff. So the goal of going into this rehab sphere is not to learn how to fix people, right? The goal is not to understand how to get someone out of pain. The goal is not to be like, oh, your shoulder hurts? Well, don't go to a physical therapist, don't go to a doctor, come to me and I'm going to give you, these bottoms up kettlebell press things and have you work on your breathing and I'm going to save you from shoulder pain, because that's a totally unreasonable thing and it's unethical. And quite frankly, a lot of coaches and personal trainers don't have the background to be able to properly diagnose and understand what's happening, right? We don't understand all the different contraindications for different activities. And a lot of this stuff too, it's like, yeah, your shoulder hurts. Like maybe you have legitimate structural damage. Maybe you have bone cancer. You don't know this stuff. So when someone is in pain, the goal is to get them to a professional who is licensed and who has had the background and the education and is plugged into the channels to actually deal with something that may be much more severe than, just a little bit of dysfunction and improper patterning and all that kind of stuff. So what we're trying to do instead by understanding rehab principles is to have a better understanding of how the body adapts to stress over time and how movement patterns are part of that process, right? So when we're talking about training, what we're looking at doing is applying stress to a system in order to create adaptation over time. So training is a stress, the body recovers from it and ideally gets better. And all kinds of things in addition to training stress are part of that stress response and how well someone adapts. So, we talked about it many times. If someone loses their job, if they're moving, if they're going through a bad breakup, if they're not eating enough food, all this kind of stuff is stress on the system that can impact their ability to respond to training. So we need to consider that movement patterning is going to be a big part of that stress, right? It's going to be affected by that stress, and also poor movement patterns can create additional stress on an individual throughout their training process. So what we're trying to do by improving someone's movement patterning is really just improve their ability to adapt to stress by either giving them the tools to move better so that their training is able to stress them more in the ways we want them stressed, and also to potentially help them break out of patterns that could be causing them more stress than they should be experiencing based upon poor breathing patterns, improper positioning, all that kind of stuff, right? If we look at the research on things like injury prevention, it's always a little bit fuzzy. It's very difficult to show that specific interventions do actually prevent injuries in the future. There's a lot of reasons for this. Even designing a study that can properly control for all the different variables, that can properly have some sort of placebo. I mean, because people are obviously going to understand what intervention they're receiving as opposed to, simply taking a sugar pill. It's very, very difficult to create proper experimental design in such a complex system. We see similar things in all kinds of emergent areas like economics, etc., nutrition, which is why there tends to be so much disagreement here. It's not as simple as simply understanding what question to ask. We have to figure out, how do we say, okay, we got knee pain. How many of these people are coming in here with limited ankle dorsiflexion? How many people are coming in here with limited hip flexion? How many people are coming in here who are hypermobile? How many people are in here because they have a pre-existing anatomical variant that predisposes them to knee pain? How many people are in here because they had a traumatic injury to the knee? How many people are in here because they had overuse? How often are these people training? What are they eating, etc.? All these variables can affect the outcome, so it's very challenging to design a proper study to figure out what actually works and what doesn't. So all that's to say that if you're telling someone, hey, we're going to do this movement screen on you, we're going to do this certain breathing intervention, we're going to have you do this glute warm up, and you're telling them that you're going to prevent injury, the data simply isn't there to support that in most cases. So I would caution pretty much anyone from saying that they can prevent injury, because the mechanisms are too complicated and we simply don't have a great understanding of what's going on. That said, as sort of a broad strokes picture, I do think that injuries in general occur when an organism is stressed beyond its ability to adapt to that stress. And that could be within a specific tissue where you've done simply too many upper body pulling movements over a certain period of time compared to your tissue's ability to adapt to that, and then you develop some sort of medial elbow pain. You've done too many deadlifts with a rounded back over a certain amount of time, and you've developed some sort of injury to the disc or to the erector surrounding that lower back, right? So there is this understanding that if we stress the tissue or an organism too much, we're going to have some sort of consequences from that. But again, we can't really say, oh, we're preventing injury. It's simply not backed by research, and it's somewhat disingenuous to say that to people. But what we are looking to do, though, is by improving patterns, we want to be able to improve the ability of an individual to express their maximum potential. So if someone is, say, doing a snatch and they have difficulty putting their arms overhead and creating a proper shoulder flexion position, let's say that they have a thoracic spine that's locked into extension, so they can't actually create more extension to get the ribs in a proper position for the scapula to move over it, to go overhead, then yes, they're probably leaving pounds on the table simply by being unable to achieve a good position. So if we can help them and get them to create a little bit of thoracic flexion, which then allows them to extend the thoracic spine when they're going into that movement, which then allows the scapula to get set into a stable position, which then allows the shoulders to go into true flexion without compensating either in the low back or by shoving the humerus forward in the shoulder joint, then we're looking at something where, yes, we may have been able to actually improve someone's literal performance in terms of pounds lifted by improving their movement patterning. But that said, I think that we're also looking at somewhat diminishing returns there depending on the individual. For some people, there are serious movement patterning issues in terms of mobility or stability that do need to be addressed before they're able to hit certain positions and try to even perform in that position. But for other people, if you look at plenty of elite athletes, they have all kinds of serious compensations. They have brutal asymmetries, they have lack of motor control of the scapula, they overextend like crazy, their hips impinge when they squat. They rotate to the right on everything that they do. They have dramatic side-to-side strength asymmetries, but they're still just really, really good at their sport. So it's not like these things are always limiting factors for people. And that's sort of the discretion of the coach to understand, hey, is this asymmetry or is this potential movement pattern issue actually preventing you from performing? Because oftentimes it's not, right? People just simply aren't as good as we would like them to be, because I've seen people who are extremely good in their sport who have just massive problems relative to their movement patterning, but they're still just able to get it done. And I think that's one of the things that can separate a lot of elite athletes from other people, is that they understand on an intuitive level, on a subconscious level, how to compensate around their problems in order to maximize their own performance. So yes, we can say that we may be able to improve their ability to adapt to stress over time. We may be able to add, incremental changes in terms of their positioning, which could help them perform better. But we're really, really not able to say, hey, you know what? I see that you overextend your low back when you do this movement. Well, if I show you how to do this, I'm going to prevent injury and I'm going to actually improve your performance over time, because you might not. And the other aspect to that too is that for a lot of these folks, they're so used to the movement patterning that they've developed that if you change it, it may not actually go well for them. It may take them a while to adapt to it, and they can often learn how to, recalibrate their movement pattern to deal with not having their compensation pattern. But sometimes if you change something too much for someone, it can throw them off and cause them problems, which is why it's hard to actually teach people who have been doing something a certain way for a long time how to do it better, because it initially feels worse for them. It may feel worse for a while. So if you're dealing with someone who has some sort of event or competition, you're like, all right, we're going to completely rebuild your squat. We're going to completely rebuild your snatch. We're going to completely rebuild your sprinting technique. That may not be a good idea if they have an event where it's like, well, guess what? I have to do this at this date because I have a sponsor who's paying me, because I have a certain number of Instagram followers. And if I can get more, then my sponsor pays me more. And simply for my own sense of self-worth and my goals in whatever sport I'm competing in, I need to do this event on this date and I need to do well. So you have to be careful with how much change you think you can make and how much buy-in you're going to get from a performance-based athlete based upon all that. So all that's to say that I firmly believe that improving someone's patterning and understanding how to do a proper assessment on an athlete is very valuable for designing a program for them and for working with them. But it's not necessarily the highest leverage activity that they can work on. For most folks, training and practicing their sport is going to be a much higher leverage than simply spending all day in quadruped doing certain reaching activities and trying to properly breathe and create thoracic flexion and all that stuff that we've been talking about. But again, if we're talking about long-term development for an athlete, we're looking at potentially removing a glass ceiling on their performance sometime far into the future, right? We're looking at, okay, if we're going to be stressing you consistently on a daily basis over the next 2, 3, 4 years, is it possible that by getting you in a better position now, we could have better performance 3 years from now? I don't necessarily have research to back that up, but I would say yes. And that's why I've really prioritized understanding how my athletes move and understanding how we can actually work on all these kinds of things. I'm not going to tell them, hey, I'm going to prevent an injury for you. I'm not going to tell them, hey, you're going to, PR your snatch if you understand this breathing exercise. But I'm concerned with their long-term development over several years. And that's why I think this stuff does actually matter. Hey, this is Todd again, and as most of you know, I consume, read, listen to, watch an absurd amount of content on a regular basis, and a few times per month I send out my thoughts on some of the most interesting or insightful stuff that I've taken a look at. You can be on the list to receive this fascinating, captivating, and delightful information at toddneef.com. That's I before E. Head over there, go ahead and type your email address in, and then as I send these things out, again, a few times a month, you'll get it and you'll be inundated with a carefully curated list of the best stuff that I am experiencing.